Did you know that not all healthcare careers offer the same rewards? In 2026, neurosurgeons remain among the highest paid clinicians in America, while many primary care providers continue to face rising burnout and administrative pressure. Nurses, physician assistants, and doctors each follow different career paths, with major differences in salary, work-life balance, and future opportunities. And here's the biggest shift. Artificial intelligence isn't replacing healthcare professionals. Instead, those who embrace AI tools will gain a powerful advantage in the evolving healthcare industry. If you're considering a career in healthcare, understanding these trends could shape your future success. Let's explore the 2026 U.S. Clinician Compensation and Career Outlook.
Most people enter healthcare because they want to heal patients. But modern medicine requires providers to navigate a system where direct patient care is frequently buried under a mountain of administrative tasks and documentation. Right now, 85% of physicians report being overworked. The demands of insurance approvals and endless charting are pushing highly trained providers to their breaking points. Deciding to become a healthcare provider means making a massive financial and temporal investment. You are putting years of your life and hundreds of thousands of dollars on the line. You have to weigh exactly what you want out of your career. Do you demand absolute clinical authority and the highest possible salary? Or do you prioritize rapid entry into the workforce, lower debt, and maintaining lifestyle flexibility? To survive in this field without burning out, you need to calculate the exact return on investment of your specific career path before you sign away a decade of your life. We are going to evaluate the 4 primary clinical roles in the U.S. healthcare system: medical doctor or DO, physician assistant, nurse practitioner, and registered nurse. This bar chart compares the educational timelines required to start practicing. You can become an RN in as little as a year and a half through an accelerated program. The NP and PA routes take about 6 years, but the MD and DO paths require an exhausting 11 to 15 years of continuous education and training. Now watch what happens when we stack projected student debt on top of those timelines. The financial burden scales aggressively. While RNs and mid-level providers take on moderate loans, the MD column towers over the rest, representing hundreds of thousands of dollars borrowed before earning a true physician salary. And when we overlay the risk of clinical burnout, the line peaks at 85% directly over that highest debt and timeline column. The longest, most expensive path carries the highest reported exhaustion. There is no universal best medical career. The right choice depends entirely on how much delayed gratification you are willing to tolerate. Becoming an MD or DO requires surviving a grueling gauntlet: a 4-year bachelor's degree, 4 years of medical school, and a residency program lasting 3 to 7 years depending on your specialty. During that decade of training, medical students accrue an average of over $250,000 in student loan debt. They carry this balance for years while making near minimum wage during their residency shifts. This chart maps the financial reality. A red line shows debt plunging deep into the negative throughout your 20s. By your late 30s, it's overtaken by a steep green lifetime earnings curve. Average physician pay hits $267,000 and scales past $760,000 for elite surgical specialties. That is the ultimate trade-off. You secure a top-tier income bracket, but you surrender your 20s and early 30s to an uncompromising training schedule. Along with that financial ceiling comes the ultimate clinical and legal responsibility. When you are the attending physician, the final outcome of every patient under your care rests entirely on your medical license. That legal responsibility translates into a crushing administrative load. You face complex documentation requirements and the continuous, grinding weight of 24/7 on-call demands. The traditional doctor route offers unparalleled authority and the highest financial ceiling in medicine, but it extracts a heavy, permanent toll on your personal time and mental bandwidth. If you want a 6-figure medical salary without sacrificing a full decade of your life, the mid-level provider routes, physician assistant and nurse practitioner, offer a highly pragmatic compromise. Both paths take about 6 years total. Both PAs and NPs diagnose illnesses, develop treatment plans, and prescribe medications. But they operate under completely different educational models and legal frameworks. The physician assistant route is built on the medical model. PAs train as generalists, completing clinical rotations across a wide variety of medical disciplines, similar to an accelerated medical school curriculum. Because of this broad training, PAs possess lateral mobility. If a PA burns out in emergency medicine, they can switch to dermatology or orthopedics without going back to school. This diagram compares the roles. PAs require strict physician supervision. The NP side highlights the nursing model and early specialization. The overlap shows shared outcomes: diagnosing, prescribing, and earning roughly $130,000. Crucially, NPs hold independent practice authority in 28 states, operating clinics without an MD. The trade-off for that independence is that NPs are legally locked into their chosen specialty. A pediatric NP cannot simply decide to start treating geriatric patients without returning to university for another formal certification. PAs and NPs sacrifice the massive financial ceiling of an MD, but in return, they secure a vastly superior debt-to-income ratio and reclaim years of their youth. For those who prioritize immediate financial stability and high demand over diagnosing authority, the registered nurse path is the fastest entry point into the healthcare system. While a traditional bachelor's degree takes 4 years, professionals with an existing non-nursing degree can complete an accelerated BSN program in as few as 16 months and immediately sit for their licensing boards. The financial return is rapid. RNs start with highly competitive salaries, averaging $86,000, and frequently scaling past $100,000 in major markets or with overtime. The daily operational trade-off is strict hierarchy. RNs execute established care plans rather than diagnosing conditions, and they follow the orders of physicians and mid-level providers. Looking at this survey table of nursing students, the push column shows the specific stressors affecting RNs. The primary drivers of burnout aren't diagnostic liability, but the physical toll of high workloads, strict shift work schedules, and a lack of workplace flexibility. The RN route is for individuals who want immediate income and prefer a shift-based job they can leave at the hospital when they clock out. To make your choice, we can map these options on the Healthcare Career ROI Matrix. This chart plots your desire for autonomy on the x-axis against your tolerance for time and debt on the y-axis. If you are young, highly risk-tolerant, and demand peak clinical authority and earnings, you are the ROI optimizer. You belong in the top right quadrant on the MD-DO path. If you want a 6-figure salary and value the freedom to change medical specialties throughout your career without going back to school, you are the pragmatic switcher. Your place is the PA path. If you want to run your own practice and maximize one-on-one patient care, but refuse to spend a decade in training, you are the independent caregiver. You align perfectly with the NP path in the bottom right. And if you need stable income right now and want the boundaries of distinct shift work, you are the speed-to-market pragmatist. The RN path in the bottom left is your target. The healthcare landscape is constantly shifting. Mid-level providers are taking on more clinical duties, and emerging technologies like AI scribes are actively dissolving the massive paperwork burden that drives burnout across all these roles. Before you take out a single student loan or put on a white coat, you must ruthlessly evaluate your own tolerance for debt, time, and stress. The optimal healthcare career is not the one with the highest societal prestige. It is the one whose inputs exactly match the life you want to live.